Hi, good afternoon, everyone. I'm Kate Guzman. I am a public health nurse and the new health officer for Oakland County. Because you don't have the press release in front of you and you haven't had a chance to read it, let me give you a little bit of the background information to start. So today, we were notified of a case of measles in an adult that resides in Oakland County. This is an adult that has recently returned from international travel. We are unsure of their vaccination status. So to give you a timeline, let me just check. Let's see, we'll walk you through the timeline. So the case returned home from travel on February 27th. On March 3rd, their symptoms began, and on March 7th, the rash began. This is an important point because, as I'm sure you all just need a little reminder about the clinical onset of measles, we look at the contagious period, the infectious period of a measles case by the date of the onset of their rash. So that's why I mentioned that date that the rash started on 3/7, because someone with measles is contagious 4 days before the rash starts until 4 days after that rash starts. So for this case, we're looking at a period of infectiousness as 3/3 through 3/11. Remember that measles is one of our most contagious diseases, with virus spread through infectious droplets, and it's airborne as well, through coughing, sneezing, singing, talking. You're familiar with all of those routes of transmission from COVID. And so I mention this because also the measles virus can live in the air for up to 2 hours after the case has left the area. I'm just putting this all together so I can give you the list of locations where this person was during their period of infectiousness. So just keep that in mind. So on 3/7, as I was saying, the rash began. On 3/8, they sought care at Henry Ford Rochester's emergency department. And on 3/10, they returned to the same ED where they were admitted overnight and discharged home on 3/11. So our timeline only includes one restaurant, Cruz and Muir on Main Street in Rochester, on March 7th between 5:30 and 9:30 p.m. And honestly, we got very lucky because the only other exposures are those 2 visits to the emergency room. It's very unusual in a measles case.
Can you repeat that one?
Absolutely. Cruz and Muir on Main in Rochester on March 7th, from 5:30 to 9:30 p.m. And then our other 2 potential locations for exposure are Henry Ford Rochester Emergency Department, that's at 1101 West University Drive in Rochester, on March 8th from 3:40 a.m. to March 9th at 9:32 a.m. and March 11th, 8:30 a.m. to 5:18 p.m. These details will come out in the press release so that you have all these dates and times secured. The reason that we want to make sure we're highlighting these locations to the public is because, as I mentioned before, measles stays airborne for 2 hours and it's highly infectious to those individuals who are not vaccinated. And so we really want the public to know, if you were at Cruz and Muir on the 3rd, we need you to be on the lookout for symptoms. Early symptoms of measles start with a fever, and it can be a very high fever, 105 degrees sometimes, a very dramatically high fever. And the classic symptoms are a runny nose and pink eye, conjunctivitis. So we're really looking for you to be watchful of those symptoms if you were at the restaurant or at the hospital emergency rooms during those times. And my request to the public, please, do not go to the emergency room if you have these symptoms without calling first. We need you to notify your healthcare provider so they can put the proper isolation precautions in place so they can protect the public and all of the other patients that would be in that facility. Because again, measles is highly infectious. Let's talk about vaccination. So the measles vaccine is highly effective. 97% after 2 doses. It's an incredible vaccine, and it's one of the few that works post-exposure. If you can vaccinate someone within 72 hours of exposure to a measles case, you can prevent their infection or reduce the severity of their infection. With this timeline, there won't be anybody in that 72-hour window for vaccine, post-exposure prophylaxis. But there is another tool in our clinical toolbox. It's called immune globulin. It's a medication that contains antibodies that can also help prevent infection or reduce the severity of the disease. And the window of time for immune globulin is 6 days. So for the people that could have possibly been exposed on March 8th or 10th and 11th at the Rochester emergency room, this immune globulin could be an option for infants that are too young to be vaccinated, so 12 months and under that haven't been vaccinated yet, or adults that are immune compromised. And so I'm urging the public, if you think that you were exposed at any of these locations and have a condition that might create a weaker immune system, please reach out to your healthcare provider to see if you're eligible for immune globulin or IG. Okay, I'm going to talk about the vaccine one more time because I am a public health nurse and vaccines are core to what we do. Remember, to be considered up to date on MMR vaccine, it's typically 2 doses. Children are vaccinated at 12 months and 4 years. That's the typical schedule. And adults that were born before or after 1989 should have these 2 doses. If you were born before 1989, you probably only have 1 dose of MMR. And if you were born in 1957 or earlier, you never got one, but you're considered immune. So we do get a lot of questions about adults that have only had 1 dose of MMR, and I'd like to address that now. Do you need a booster? Possibly, yes. So we typically say if you work in healthcare, if you travel a lot, if you have some possible exposure to measles, and you're an adult that only has 1 dose on board, it would be a great idea to get a second. And as cases are increasing nationwide, worldwide, we will start to see more in our community. Think about getting that booster dose. If you could be someone that only has 1 dose, an adult with 1 dose on board, it could be time to get that second dose. I'd be happy for anyone to call Nurse on Call if they have questions and can't maybe reach their healthcare provider. Our Nurse on Call phone number is 848, I'm so sorry, 848-5533. Yeah, sorry about that. And there are expert nurses that can help advise who should be getting a booster dose, how many doses should you have, and when, and how. It's a question that we get a lot. I think I covered everything, and I'd be happy to take some questions, but please remember that we are protecting the confidentiality of the case, so I will not be giving any more information about the actual case themselves. Oh, so sorry. Yeah.
The exposure in Henry Ford, was that on University Drive?
I have the address. It's the Rochester Henry Ford, 1101 West University Drive.
And you're talking about these measles cases going up. Can you tell me why?
Yeah, so in Oakland County, just as an example, our childhood vaccination rate for MMR, the MMR vaccine is the measles, mumps, and rubella vaccine, it hovers right around 80%. 79, 80.5, right around there. In order for our community to have what we all know as herd immunity or community immunity, for measles specifically, that rate needs to be at 95%. So we are very much below the vaccination rates for this community that we need to be protected against measles. So when I say the rates will go up, they will go up.
And if someone gets this with a compromised immune system, can this be deadly?
Yes, absolutely.
What country did they travel from? You said it was international.
I can't share that.
Can you rule out if it was Canada or not?
I don't know. Can I rule anything out, Bill?
You can't share it because it has the potential to identify the patient to others.
Do you think you know the exposure point for the patient?
Internationally.
But you think they have isolated what day they contracted it possibly? Or how would you even trace that if you're able to?
You can't trace it exactly, but we know a lot about the clinical progression of measles symptoms to know when the fever starts is typically, maybe 4 days after exposure, and we can trace back that way, but you can't exactly pinpoint it. Because of the way measles stays in the air, unless you knew, like I'm a nurse and I had a patient with measles, like that's my point of exposure, right? But someone in the public like that, it's really hard to pinpoint.
I'm not asking you to get political, but I think it's important to ask that in this day and age where we have so many for different reasons knocking down the benefits of vaccines and disinformation surrounding it, and it's a very personal thing for a lot of people.
It is.
As a medical professional, you see what's happened in Texas. We we have our case here. I don't know what you would care to say, and if you don't, I understand that too. But what would you say about people, the questioning of vaccines and the damage that does?
It's a really great question. We talk with families every day that have concerns about vaccines, and we work really hard to earn the trust of vaccine hesitant families. We love to provide education and the facts on the safety, the testing that vaccines go through, and we really work hard with families to come up with a testing schedule that they're comfortable with. When we're faced with an outbreak, global outbreak, nationwide outbreak, we can't be as flexible with that vaccination scheduling as I want to be, right? If our vaccine rates were up and we had herd immunity, I would happily say, get your child one vaccine every 6 months for the next 3 years and we'll get them all done slowly, and it'll be comfortable. But when we're in a situation like this, it's important to get that protection now.
What do you say to people who may have been exposed or their children exposed and maybe they don't have symptoms or they don't know, or maybe they do have symptoms?
Yeah, well, it takes a few days from exposure to develop symptoms, and so that's the concept of just kind of watching. If you're starting to develop a fever or your child is developing a fever, runny nose, many times we can just dismiss those symptoms, right? It's spring. Everyone's got hay fever. Who's not going to have a runny nose, right? And so this idea of knowing where the local exposures were are so important because you won't dismiss those symptoms then. So if you know that you were at Henry Ford Rochester and your child has a runny nose, think a little differently. Don't just dismiss it as, oh, everybody gets this in the springtime, right? Watch for the fever, call your provider, call your healthcare provider. I think it's really wise right now in this climate.
Can the fact that we aren't at herd immunity impact the efficacy of the vaccine for people who are vaccinated?
No, I don't think so. That's a good question. But the vaccine efficacy is per person, right? It has to do with the person's immune system, not the community-wide herd immunity.
Just discuss more about the pre and post 1989 aspect of it. Like,
Yeah.
they rush to get that second dose.
If you were born before 1989, like myself, like probably many of you here, and you're traveling, or you are hosting visitors that are traveling internationally, or you work in healthcare, it would be a great idea to get one additional dose of MMR vaccine if you only have one dose on board. If you were born before 1957, you're assumed to have immunity. So we're not recommending that right now, but talking with your healthcare provider, they might have a different recommendation based on your own health status.
You
Sorry.
mentioned that you don't know if this person is vaccinated. How would you not be sure? Why would that be?
Well, adults don't have vaccine entries from their childhood in the MICR system, and I don't know that we've been able to get their childhood paper record in this short of time yet.
And just to be clear, we don't know yet. There's no confirmation or non-confirmation that anyone did get it from this patient.
Oh, absolutely a great point. We have no confirmed secondary cases from this case.
When were you made aware of it as well, exactly?
11:30, right before noon.
Can you share how concerned people should be? Meaning, you're obviously here, we're talking about it, it's of concern. But if people are properly vaccinated, we see what's happening in Texas, we talk about everything swirling. How concerned should we be taking this news? Do you worry about proliferation here locally?
Well, it's a great question. The vaccine works extremely well. I'm not worried about vaccinated individuals. I can tell you as a nurse, I am vaccinated, fully vaccinated with the MMR vaccine, and I was front lines during our last measles outbreak in the homes of every single measles case, swabbing every single one of them, homes with multiple children sick, and I was completely protected, right? I obviously had PPE on, I was wearing masking, and I was wearing my protective gear, but I firmly believe the vaccine does work. It's got a really high efficacy rate. So for those individuals who are vaccinated, it's not a high level of concern. But we can't vaccinate babies until they're 6 months old. The typical vaccine schedule is at 12 months, but we can vaccinate them as early as 6 months. And so if there is a family that is hosting international travelers or they plan on traveling and their healthcare provider determines that they're high risk, the infant may be vaccinated early to help protect them. Now, it won't count for their 2 doses for their childhood vaccine series. They'll still have to get those 2 at 12 months and 4 years. So they will end up with 3 doses throughout the course of their childhood. But that is one measure that we can think about really to helping to protect the community. Those are the people I worry about the most always. The youngest, the oldest, and those in between that are the most immune compromised.
And are those the same people that it is harder on?
Of course, absolutely. Yep.
Maybe if I missed it, is there an age associated with this person? Did you say it, or did I miss it?
Adults.
You're not saying how old.
But you. Oh, I'm sorry. Go ahead.
I have one last one, and I'll be done.
It's okay.
Can you talk about if somebody contracts it like this individual has, how long are they contagious? How long does it run its course?
Yeah, no, it's a great question. It can take, how long it runs its course varies by person, but they're contagious from 4 days before the rash onset until 4 days after the rash onset. So it's like an 8-day period of contagiousness. You're very welcome.
Obviously, again, you found out at noon, just before noon today, and you wanted to get out here at 4 o'clock to make sure.
Absolutely. Before the weekend, we just wanted to make sure, because we're this window of time where that immune globulin is effective is closing in on us. And so I just wanted to really make sure that anyone that is eligible for IG, that immune globulin, had an opportunity to seek that in the next 2 days.
If you've had measles before, can you catch it again?
Typically, no. I don't quote me 100% because everybody is different, but typically your body will make antibodies. You will have those antibody responses, and so you would not get measles again. Can I?
In the 60s, I wanna make
You're
sure
good. You're immune. You're considered immune. But can I speak to that for one moment? Just a little off paper here. There is this misconception. It's happening in Texas that natural immunity is better than vaccine immunity. And we see this a lot with varicella, with chickenpox, and it's happening again with measles, where our families are hosting measles parties, they're called, where they want to get their children exposed to a natural case of measles so that their child builds immunity to measles, because there is a misconception that natural immunity is better than vaccine immunity. I cannot discourage this practice enough. Measles parties are dangerous and they threaten the lives of our young children. Please don't engage in this behavior.
for older folks, I'm going to go back to that again because I have a doctor's appointment tomorrow.
I love it.
And I don't believe I was vaccinated between 62 and 1972. By the time I caught it, it's very miserable if you've had measles.
Aw.
It is no fun. I remember it. It was horrible. An adult who's not sure of their
Mm-hmm.
vaccination status in their 60s.
Get another vaccine. Just get the vaccine.
It's just safe.
We're not going to say no. Just if you don't know if you got the vaccine, just come and get one. It does not hurt you to get an additional vaccine. There's a small caveat too. There's a group of individuals, a few years, I wrote it down here. It's 1963. It's in the 60s. Sorry, I have way too many notes. 63 to 68, I think, where there was a vaccine that is not quite as effective as our current vaccine. And so there is a group of individuals as well who did receive one dose in the early to mid 60s, that they should come back and get an additional dose as well, because that was not the best vaccine it was not the most effective vaccine.
You said 80%, the vaccination rate is 80%. Like, do you know if that's for children, or do you know if
That's for children. I'm sorry, I should have said that. We don't have good record of adult vaccine rates because adult vaccines are not mandated to be placed into our MICR system, which is our immunization registry. Childhood vaccines, so anyone 18 and under, every vaccine that they get, we put it into a registry, and that's where we calculate our rates from. So those are the childhood rates.
And are you most concerned about the spread of this one case going to children?
Of course, because children are really just vectors. They're like the vehicles of infectious disease, right? When we're talking about runny noses and coughs and you're looking at children, I mean, who has children around them that are like wiping their nose, coughing on everything? I mean, they're just like the perfect transmitters of infectious disease. They're also the most vulnerable to severe disease outcomes.
That 80% that you mentioned, has that gone down from where it was?
We're hovering. I'm using that word hovering because we are like 79, 78, 79.6, 80.1. Like we're just kind of hovering.
Year to year is not.
We've gone down. We went down dramatically in all of our vaccine rates during COVID, and then we've been slowly climbing. In the past few months, though, we're really plateaued. It's a shame. We saw some nice increases right out of COVID and then haven't really seen more increases since then. All of the vaccines are a little different, though. The MMR vaccine in general has a little bit more hesitancy around it. So the MMR vaccine rates are a little lower than some of our other vaccines.
To Corey's question about being revaccinated, do you advise consulting your doctor, or does the health department offer
You can come here. Yep, absolutely. You can call Nurse on Call. You can come to the health department. You can contact your healthcare provider. We can all help assess if you need an additional dose. And I'm going to be honest, the default answer is most likely going to be, let's just get you another dose. If you can't find your vaccine record, if you're not sure if you had measles or you had German measles, like, let's stop trying to call your mom and to have her tell me all about your symptoms. I've gone down that road. Let's just give you a vaccine.
no pre-existing condition concerns if people have other health-related issues?
For the measles vaccine, pregnancy. We don't love to give live vaccines during pregnancy, and the measles vaccine is a live vaccine. Or someone on a really heavy-duty immune therapy treatment, maybe someone in cancer treatment. It would be like severe cases.
So consult your doctor.
Always.
In terms of the rash, can you just describe, I guess, where on the body?
Oh, I love you. I love talking about measles rash.
What does it look like? Because, you know, I get heat rashes all the time.
Yeah, no, I actually should have pictures. I probably have pictures on. Yeah. Anyway, it starts on your scalp. Actually, it moves its way down to the face and then to the torso. It's very diffuse. Diffuse meaning like spread widely, and it's like a little raised. It looks a little hivey, a little heat rashy, but it's very distinct. If you've seen a measles rash, like, it's very easy to see the next measles rash. But definitely, it's distinctive because it starts on the scalp.
What color
Always
is it?
like that?
Red.
Okay.
Red. Yeah, it always starts on the head.
And it's red.
Yeah, and it's red. Yeah. On a darker skin, it looks a little less red. So you have to imagine, like, with different pigment in skin, it looks a little different on darker skin. Yep.
Hey, Robin Erb from Bridge Magazine, who's listening on the phone, has a question. Do we know how busy the ER was at the time?
I
In other
don't.
words, how worrisome
Yeah,
was it?
it's such a good question, Robin, and I don't have that information. I'm sorry. Because we wanted to get out here ahead of the weekend, we have lots of information still coming in that we're collecting, and our communicable disease team is working hard on that, but I don't have that information yet.
My question is about the connection to either international travel or hosting international visitors. Are you at greater risk because of that, because the vaccination rates are lower overseas?
It would depend. It would depend on if your guests that you're receiving are vaccinated.
Okay.
So think about that, right? If you're receiving guests that live abroad and they're fully vaccinated, I wouldn't have any concerns. It's not, I can pinpoint countries, yes, with low rates of vaccination in general. There will always be lots of countries that don't have access to vaccines, so their vaccine rates are very low. But just in general, international travel has so many airport stopovers and layovers, and you've just got such a blend of people from all over. I mean, it's just a perfect storm.
My last question. You said
It's okay.
this affects the most vulnerable is kids. What could be the potential effects? And I'm guessing seniors and immunocompromised. Once again, could you just tell us who this could be potentially deadly to?
Yeah, I mean, I'm worried most about infants. Their bodies just aren't designed to fight this, right? Older individuals as well. I mean, it's kind of the same thing. Like if it's going into the lungs, it's a respiratory illness, and so you could have all types of. So I'm trying to not use really clinical sequelae. Like you could have that, all the respiratory downfall that you would see with influenza, very similar. And measles can also lead to a neurological decline, neurological conditions as well.
I think coming out here, what's your biggest message to the public today?
That vaccination is our best protection against measles. And if you were at one of these exposure locations that are on our press release, please watch for symptoms. And in order to limit the spread to other individuals, call ahead before seeking medical care. Thank you.